What are certain myths that you want for us to debunk today?
So Black and brown women being more fertile than white women or Asian women or anything like that. That's actually not the case. All women have similar rates of fertility. But and by that same token, women have equal opportunity for infertility, which means that anybody can be infertile, even women in our communities, even women who've had babies already, even women who come from large families where their mother and grandmother had lots of kids. And so we're not immune to this in that way. When, Black and Latino women do experience infertility, it can be so crushing because no one ever told them that this could be an opportunity, or they see other people around them who are having children easily, and it can just be really, really tough. And so the more we talk about it, the more we acknowledge that, hey, this is something that happens to us too, we're not exempt, then the better we can be. The effects of things like birth control on your body. And I think this one is really hard because, like most medications, birth control can have different side effects, and it's not a one size fits all. Some people might do better with, a different combination or a different method. And sometimes it's just a matter of finding what works for you as an individual. But when we discount the benefits of contraception, hormonal contraception, then we lose out on the opportunities to help build our families the way we want. Birth control gives us the option. If you speak to women from 2, 3 generations ago who didn't have access, like grandmothers up, they would be like, oh, maybe wish I didn't have as large of a family, or didn't have to have, an extra baby or here or there. If you have contraception, you get to decide when's the right time to hold off, and then when's the right time for you to go ahead and proceed. And I think that actually is a really important thing, because sometimes for women who may build their families when they're younger and not feel like they have a lot of control, they may think that this is it, and just tie my tubes, without thinking that later down the road, hey, I might want another baby when I'm older and have a different job and have a different relationship and a different status. But then if your only default option to controlling your contraception is tying your tubes, then you've actually created a process by which you're now infertile. I bring that up because it has been shown that Black and brown women have higher rates of tubal sterilization, what we call tying your tubes, than non-Black and Latino women. And that's a big problem because it's a counseling issue, and it means that we're missing some of the other steps along the way that could help us.
Why do you think that is?
Racism.
Okay. Okay. Okay.
This
Thank you.
desire to control populations and control, we've seen it before, not just in the United States. We've seen it in Puerto Rico. We've seen it in
Yes.
other, populations, where there's this desire to say, hey, this person has too many kids. They need to limit that. But also, I think this misinformation about contraception plays into it as well. Because if you're offered a pill or something like an IUD, an intrauterine device, which can provide very good contraception long term, but you don't trust that. That's not what other people around you have had good success with. You want your tubes tied. Then you're not kind of open to the full possibility. Also, on the provider side, sometimes, doctors are pushing one option over others, saying, she needs to have her tubes tied before she leaves, or presenting this as a more successful or lucrative option than something that actually has been shown to have higher success, which is using an IUD or an implant that goes in your arm.
Wow, that's so powerful. That is so powerful. And from a biological perspective, when a woman ties her tubes or burns them and whatever, what does that do to the female body?
Actual, what we call tying of the tubes, it's not actually tied like in a knot or anything. there are multiple different ways to use this kind of contraception, which we call sterilization, because without the fallopian tube present, sperm and egg don't have a way to meet each other in a normal, healthy way. So that's how it avoids pregnancy, is it kind of blocks that communication, or this like tunnel or highway where sperm and egg are supposed to meet. So the tubes can either be completely removed, which is more popular now because that can actually decrease your risk of ovarian cancer later in life. The tubes can be just cut in the middle. And so if you imagine, if you just cut out a middle section and left both ends, again, it's less likely that they'll kind of come back together. The tubes can be cauterized, which is a fancy word for kind of like burning them, which induces damage. Or sometimes we would even place clips or rings or kind of a structural way to kink the tube. And so luckily, it's not anything that's hormonal. It does require a surgery, either like when you're still in the hospital after having your baby, or you would have an outpatient surgery at a different time. Sometimes people can feel a little bit more discomfort with periods or irregular bleeding for the first few months after getting their tubes tied. Most people feel great. It's not a huge change in the anatomy by kind of disrupting the tubes. And you could still carry a pregnancy in the future if you did something like IVF, but unfortunately, it significantly decreases the chances that you will get pregnant on your own, less than 1% chance.
And so I did want us to kind of revisit the process, or what IVF is.
I usually say there's 4 things that you need to create a pregnancy. You need a uterus, because that's where the pregnancy is going to grow and expand and grow with time. You need fallopian tubes, as I mentioned, because that's how sperm and egg meet. You need sperm from either a partner or a donor. And then you need eggs, which are from the ovaries. And so anything that can impact one of those 4 can impact your fertility. The 2 biggest reasons why we pursue IVF is if there's a significant issue with the fallopian tubes, or if there's a significant issue with the sperm. But sometimes there's an egg issue, either not enough eggs, or responsiveness of the ovaries to different medications, or you may need to use someone else's eggs in order to achieve pregnancy, particularly if you've gone through menopause or early menopause. Surgery on the uterus, that makes it a little bit more difficult to get pregnant naturally, and so we may recommend IVF in that instance as well, or just older age. As I mentioned, it does become more difficult, even though it's not impossible. So that's important to know, because we talk about that a little bit too. How it can get scary, these different terms that are put on you as you get older. But it is more difficult. And that's something I want people to be aware of, because if you're, going through it, or you're trying and you're not getting the results you want, which is a pregnancy, then we want you to be seen sooner and not wait as long. So with IVF, there's 3 main parts. One is taking injections to stimulate the ovaries to make more than the normal number of eggs that they would make or nurture in a month. And so typically we ovulate 1 egg per month. That means that out of a cohort of, say, 10 eggs, 1 of them grew, had the right hormonal environment, release the egg, and then, you kind of move on. With IVF, because some of the processes are happening outside the body, we want to grow multiple eggs at a single time. And so out of those 10, we're hoping all 10 of them can grow and be mature. And in order to help them do that, you have to take injectable medication, the injections that you usually give yourself in the abdomen or thigh or something like that. So that process is first. It's growing the eggs, which takes about 7 to 10 days of taking those injections, and frequent visits to the doctor during that time, so that we can make sure that the eggs are growing and then know exactly when to remove the eggs. The second part of IVF happens in the lab. So once the eggs are ready, you have to have a procedure, a same day kind of surgery procedure, to remove the eggs. The eggs are removed through the vagina. There's no incisions on the belly. You do need anesthesia, so you have to have someone who can like accompany you home. But patients go home maybe 30 minutes after procedure, feel very well, tolerate it very well. Once the eggs are removed, then in the lab under a microscope, we can use a single sperm and to inject it into an egg. And so the second part of IVF is kind of happening outside of the body. That is the in vitro instead of in vivo, which means in body. And so everything that typically would happen in the fallopian tube, sperm meets egg, they turn into a fertilized egg, and then it grows into an embryo, would now be happening in the lab. We're able to assess, okay, how does it look? Does it look the way that it should? The number of cells that are growing, the rate of growth. And then once we have a normal, healthy, good quality embryo, then we're able to say, now we have to introduce it back to the body to create the pregnancy. So the third part of IVF is what we call the embryo transfer. And this is where we take that very, very small embryo, which is the cluster of cells that'll grow into a baby, and place it into the uterus. So in a sense, we skip the fallopian tubes. We bypass the fallopian tubes to create the eggs, mix them with sperm in the lab, and then introduce the embryo into the uterus. So each of those steps can take, 2 or 3 weeks for preparation. And so usually this is kind of more on an order of a month or more of a process if you're doing all of the IVF, a little bit different for egg freezing, which is shorter. But it is something that is commonly done in the world. There's over 8 million IVF babies born globally. Probably more than 1 million or 1.3 million in the US. And the number's probably going to continue to increase as we're all, having children later in life and may have more challenges that way. Also, more and more people are freezing their eggs and they may come back for those eggs, and that process would be considered kind of like IVF too. It is definitely something that Black and brown women do. I'll just put that out there. There may be less visibility. People may talk about it less because they don't feel so comfortable, or they feel like they may be stigmatized. Also, it's not always covered by insurance. Some people are very lucky and have very good coverage for IVF or in vitro fertilization, and other people don't. That's probably one of the biggest barriers is cost in our communities. Again, I would always recommend to have the evaluation, call your insurance company, see what the options are, because you'd be surprised. Sometimes you have coverage when you never really thought. And then there may be other ways to kind of cover the expense if it's not covered by your health insurance.